The COVID-19 pandemic has brought on many attendant issues, including the need for a safe and clean environment, as well as proper hygiene and sanitation practices as countries move into lockdowns with restricted movement and access to critical goods and services. International NGO World Vision Ghana has been monitoring the situation in Ghana and observes waste management during this pandemic poses significant challenge to environmental health. Now, Atta Ahin is the WASH coordinator for World Vision Ghana. He joins us via Zoom for a conversation on this particular matter. Also on the phone is Dr. Justice Yangson, who is the General Secretary of the Ghana Medical Association. Good afternoon to you, gentlemen.
Good afternoon.
Good. You can hear me. Now, tell us more about, I'm starting with you, Mr. Atahin. Tell us more about your observation during this COVID-19 pandemic as far as environmental health and practices are concerned.
Well, thank you very much, and good evening to your cherished viewers. Let me say that, well, we have been pleasantly surprised. Certain things have been done well, obviously because of the pandemic. We see an increasing momentum in trying to deliver improved sanitation in various parts of the country. I mean, if you consider the fact that there was a massive cleanup exercise across the country, if you consider the fact that there was a disinfection exercise at the markets and all places, I think that by and by, we are beginning to wake up to the realization that improved sanitation saves lives, improved sanitation promotes health, improved sanitation is wealth, and improved sanitation is well-being. And I'm happy that government is beginning to wake up to this realization. I think that we could have done this much earlier, but better late than never. I think that we are doing quite well. Plus, citizens' attitude towards hand washing, especially, for me, I think these are quite impressive, and we need to sustain the gains.
But let's narrow it down to two major issues first. That is waste management, and I'm talking about refuse gathering and refuse collection. Tell us your impressions about that.
Well, I think, and I've always held the view that this is an industry that has not received adequate support. And especially around this time when waste can no more be handled in a business as usual manner, I think that the waste management companies or the industry needs to receive a lot more support, because now you are dealing with biomedical waste, you are dealing with all kinds of waste which are hazardous. And I think that this is the right time for government to provide these industry players with some fiscal incentives and other support. Well, the president, as part of the launch of the National Sanitation Campaign, promised to provide them with some fiscal incentives and also support them to be able to acquire state-of-the-art equipment. Because now this is a public good, and once we import a truck for waste management, you can't use it for any other thing. And so I think that there's that strong call on government to support these players so that waste is treated safely and does not become a source of, infection to citizens.
Have on the line with us Dr. Justice Yangson. He's General Secretary of the Ghana Medical Association. Doc, from where you stand, how do you think medical waste is being treated?
Well, let me just say that I also add on to or re-echo the comments by my colleagues that when it comes to general waste management, COVID has actually brought a bit into the limelight in terms of hygiene, fine, but the general waste management bit, we still haven't actually done much. And I think as a country, we have paid lip service to this for far too long. there have been political promises by all governments, including this current government and president. But unfortunately, Accra or Ghana hasn't become the cleanest. And that is still a source of worry because beyond COVID, it still gives us a lot of problems at the health facilities, i.e., people coming in with all kinds of preventable infections, which can actually be linked to our dirty environment and our approach to doing things. But specifically on medical waste, it is a subject that I think is not far-fetched from the general. Reason being that some facilities may have what you may describe as something close to standard or internationally acceptable means of disposing medical waste. But for a large majority of facilities, especially outside the cities, most of the medical waste disposal is just something that does not meet the required standard. And we will need to work on that as well, just like the general waste management.
Let me put that same question to you, Mr. Ahen. How do you think, biomedical waste is being managed? Are you satisfied with the way it's being managed? We have a lot of PPEs, face masks, gloves, all of that being disposed of. How do you think that is being managed?
Anticipate this one. And so we have not made the necessary investments to deal with it. And that is the stark reality. We do not have the infrastructure which is developed to be able to deal with this because it's a new thing. But thankfully, private sector operators have already invested quite heavily in this area in terms of the treatment, the recycling, and the management of waste. And so we have a number of compost plants, we have a number of recycling plants, both in Accra and in Kumasi, which we can take advantage of.
Thank you very much for your time, gentlemen.